So are you aware that not every mosquito bite causes malaria? My name is Nurse Jacob Godness from Stethoscopes and Sacrifices, and today we'll be discussing malaria fever as a medical condition. Now we'll be talking about malaria fever, the signs and symptoms of malaria fever, and we'll look at possible treatment of malaria fever. Please take note that this is not for any form of diagnosis nor treatment. It is strictly for educational purpose, brought to you by Stethoscopes and Sacrifices. So as we proceed in our discussion, I would let you know on when to see your physician, okay? So just take this as a form of knowledge, but there is a time I would let you know on when to see a physician. So malaria fever is a serious and sometimes fatal parasitic infection caused by the female Anopheles mosquito. Now, what happens is this: the female Anopheles mosquito sucks from an infected person and then transmits to the bloodstream of an uninfected person or of another person. How does this malaria fever manifest? The symptoms usually manifest within 10 to 15 days of exposure to a mosquito bite. Now, it manifests through fever and chills, headaches, we have muscle aches and fatigue. At every slight provocation, at every little activity, you are tired. Okay, there's also nausea and vomiting. Nausea, in a layman's language, is simply the urge to vomit. So most times you feel like there's an urge to vomit, yet you are not vomiting. Then there's jaundice, which is yellowing of the skin or eyes. Okay, and then if not properly taken care of, the complication could lead to anemia. Now, the malaria parasite or the Plasmodium parasite per se destroys red blood cells. Okay, and so if you don't take care of them easily, or if you don't take care of them quickly, it causes anemia. It causes also organ failure, because first of all, it rests on the liver, okay, damaging the liver and by extension damaging other organs. Now, what are the risk factors of this disease? What are the risk factors of this malaria? People living in riverine areas, okay, or swampy areas per se, okay. People living in swampy areas usually are prone to malaria fever, as well as people living in dirty environment. Now, mosquitoes usually love to live or habit in dirty environments usually, and so if there is poor sanitation, there is poor environmental hygiene, you are prone to malaria. Okay, we also have vulnerability. There are children under the age of 5. Remember, in our last podcast, we talked about malnutrition, and we talked about children and pregnant women. They are the most vulnerable. It still applies to this. In malaria fever, children under the age of 5 are vulnerable to malaria. Remember, I said the reason is because their immune system is not properly developed at this stage, so they are prone to whatever kind of attack that comes to them. Also, we have people who don't sleep in mosquito nets. Now, usually there's this provision for mosquito nets that usually prevents this mosquito from getting in touch with you, okay? Because first of all, before malaria occurs, there has to be contact, and so if there is a barrier between the insect and the person, there would be no contact, and by proxy, there is no form of infection. So how is malaria treated? How do we treat malaria? First of all, having seen all of these signs, haven't manifested all of these signs. Like I said, this is strictly for education, not for any form of diagnosis. So, haven't manifested these signs, it is best advised that you see your doctor. But meanwhile, the malaria is usually treated using the artemisinin combined therapy, okay? ACT for short. Now, the artemisinin combined therapy are drugs that help in fighting these Plasmodium parasites in the blood, and usually killing them off after 3 days or more. Are we together? So how do we even prevent malaria completely? How do we prevent or completely eradicate malaria? It is possible. Environmental sanitations, sleeping under well-treated nets, avoid staying in swampy areas, okay? Personal hygiene is also very, very important. Good nutrition, because your nutrition helps in building your immune system. Okay, so good nutrition is as well a very good method of preventing malaria. I hope this helps, and I'll see you next time.